Hello, and welcome to our webinar about Crype and eHealth Connect, the new generation of medical communication. I am Daniel, and today I will show you how this solution makes your hospital or practice daily routine easier, safer, and more economical. Imagine no limits in communication, no insecure systems, no delayed file transfers, but maximum efficiency, saving time, money, and in serious cases, even lives. Let's get started. In modern medicine, speed, precision, and safety, and the management of massive data volumes, such as DICOM files from radiology or cardiology, which must be managed and transmitted rapidly and in compliance with data protection regulations. Availability around the clock, integration into existing systems, and GDPR or HIPAA compliance are crucial, especially in emergencies. Without these standards, delays, errors, and unnecessary costs occur. Crype offers the smart, integrated solution for this. Current systems with DICOM email, DICOM VPNs, or CDs are outdated, slow, expensive, cumbersome. CDs lose data. VPNs are inflexible, and portals create media breaks and security vulnerabilities with high ongoing costs. All of this slows down your team and strains your budget. Crype fundamentally changes that. A user-friendly, cost-saving solution with up to 90% savings potential. Efficient, secure, modern. Let's take a look at what is possible. Let's start with the core of Crype, the secure data exchange. They transmit medical data, DICOM images, reports in original quality, and 100% encrypted, directly from device to device. No intermediate server that reads along, no risk, no compromises. The peer-to-peer technology of Crype ensures maximum data security, reliable, globally scalable, and ready for immediate use for secure exchange between colleagues, patients, or partners. See for yourself how easy it is. In this demo, I will send a comprehensive CT study with additional attachments, PDFs, videos, images, all simply via C-mail. No comparison to CDs. This saves hours and reduces administrative effort by up to 50%. With a drag and drop or through the file manager, you can insert patient studies directly into a C-mail. I select my colleague, Dr. Adams, or the patient as the recipient. With one click, you can open studies, series, and images in the integrated multimedia viewer. All data are displayed clearly structured. Navigate intuitively through preview images, choose layouts, organize your monitor view via drag and drop, adjust brightness and contrast, use predefined window level values, rotate, mirror, annotate, measure distances and angles, and determine Hounsfield units. For special views, 3D reconstructions vividly illustrate medical correlations, ideal for patient education. Everything directly in Crype, without intermediate storage or PEX import. And don't worry, all edits are only visual. The original data remains unchanged. Save image editing results as a screenshot and attach them to the C-mail. Add a personal message, click send, done. Dr. Adams not only gets these images on his PC, but also synchronized to his smartphone. Crype transmits peer-to-peer over private channels, end-to-end encrypted, security like in Fort Knox. A highlight for professionals. In the burger menu, customize your working environment. Hanging protocols per modality. Individual mouse functions. Preferred tools. This saves time, provides clarity, and makes everyday work noticeably easier. Crype excites not only your team, but your patients will love it too. You receive their health data directly and securely in their personal Crype health record. Complete data sovereignty. Patients decide for themselves who gets access and who does not. Collaborating doctors have immediate access to all relevant information, seamlessly discuss cases with colleagues or patients, and forward data purposefully to where it is needed. All parties maintain full control. This builds trust, engages patients more closely, and significantly reduces appointment cancellations. More satisfied patients, more loyal referrers, and a significantly more efficient network. This is exactly the digital transformation boost your facility needs now. Now comes the game changer, the Crype DICOM Bridge. It automates the sending and receiving of medical data directly from your existing PECs. Send image data to other PECs, to patients, or receive data that patients send you via Crype. Everything is forwarded seamlessly. Integration is simple. Connect PECs, RIS, or HIAs with minimal effort. Routing rules can be flexibly defined for automatic or manual data transfer. This saves time, reduces errors, and significantly relieves your team in everyday operations. Now life. The DICOM Bridge and Crype are quickly ready for use in less than 30 minutes. You set routing rules in PECs, recipient and access rights, and activate audit logs for 100% compliance who sent or received which study and when, all documented seamlessly. The best part, your own team sets everything up themselves without external service providers. This saves effort, increases availability, and noticeably reduces maintenance costs. This way, your IT finally has time again for innovation instead of troubleshooting. And now to automation magic, the Crype ID. Every doctor, every clinic, every patient receives a globally unique ID with Crype. Save this in the HIS or RIS and transfer it, for example, via DICOM worklist into the suffix of the patient's name or in the referring physician's field. Once the images go to PECs, the Crype ID is sent along. From this moment, everything runs automatically. The DICOM Bridge recognizes the recipients and forwards the data directly and without manual intervention. At the same time, video, audio, or C-mail communication is immediately available with patients, referrers, or colleagues worldwide. Missing the ID? No problem. The data is immediately imported into a queue in Crype and ready for manual dispatch. Maximum automation, fast, secure, error-free, and simply motivating. Before transfer, the DICOM Bridge can automatically anonymize patient data, ideal for second opinions, AI analyses, or studies. If results, for example, come back from an AI via the same Crype account, the bridge automatically restores the original data and forwards it directly to PECs, securely, GDPR, HIPAA compliant, and without manual intervention. This way, you always maintain control, and your patients know their data is in the best hands. In short, less effort, more security, significantly lower costs. A real win-win. Send image data directly to radiologists. Without VPNs or boring DICOM emails. Conduct live video meetings with screen sharing, also directly from the high-resolution diagnostic monitor. Earn additional income through remote diagnoses, thousands of euros extra, and access to global expertise. With a click, you can start a secure video conference, share high-resolution images, and use the integrated whiteboard for joint findings discussions as if you were in the same room. Whether second opinion, interdisciplinary coordination, or patient education, everything runs efficiently, true to image, and fully encrypted. This makes collaboration simple, secure, and effective. And now the best for your patients. The private, absolutely secure Crype health record. The simple, decentralized alternative to complex central solutions. Patients receive images and findings directly, import old CDs or portal data with just a few clicks into the Crype archive, and decide for themselves who gets access. This strengthens patient loyalty, saves costs, and creates genuine trust. A real game changer. For general practitioners, mobile imaging, or small practices, Crype even becomes a complete solution. Send, receive, archive, and view data directly in Crype without PECs. Modalities can be easily connected via DICOM bridge, and teleradiologists can be consulted if needed. Less technology, lower costs, more time for your patients. The web app panel transforms Crype into your real command center. Connect his, RIS, PECS web viewer, remote control of MRI or CT via cloud scan, and any other web application with one click. From now on, you control everything through a central, clear interface. Say goodbye to the tedious window chaos caused by countless individual apps in daily practice. One workspace, everything included, maximum efficiency. This is what the future feels like. And here comes MedQuery, the built-in power search for every PECS. With MedQuery, you are directly connected to the web interface of your PECS archive. According to your rights, you can access all patient data from anywhere in the world via Kidu and Wado. No additional software, no VPN, no extra third-party, zero-footprint viewer. Simple, super secure, fast, and revolutionary. See for yourself. Enter patient ID, patient name, or accession number. The results appear immediately. With one click, you can open one or multiple studies in the Crype Multimedia Viewer. And now, the icing on the cake. Right next to each patient's name, or the involved doctors, you see the small Crype icon. A click on it, and you are immediately taken to the Crype dialog panel. Now, you can send CMail with the images, call the patient or referrer, start a secure video conference immediately, or forward the study. This is how simple, modern, patient-centered collaboration can be. Zero-footprint integration, the dream for every IT department. Connect Crype directly with MedQuery to your HIS, RIS, or any other clinical software. A click in the external system, and the images open in full DICOM quality via app or browser in the Crype Multimedia Viewer. No additional installation, no separate viewer needed. And it works the other way around too. The complete Crype DICOM viewer is available as a pure web HTML component and can be embedded into any third-party application in seconds. Crype eHealth Connect is continuously evolving. Powerful extensions are planned for the future to make your daily work even more efficient. Folder structures for CMail, for even better organization and structure of your communication. Calendar integration, appointment scheduling directly in Crype. Simple, clear, synchronized. Multi-camera support, ideal for parallel video transmissions from OR, endoscopy, or ultrasound. Remote PC control during screen sharing, even more flexibility in collaboration. AI tools and extended 3D reconstruction, intelligent support in diagnostics and communication. Customized CMail templates, standardized findings, reporting, and transmission. These innovations make Crype future-proof. More functionality, more efficiency, more potential. Crype eHealth Connect revolutionizes medical communication. Absolutely secure, intuitive to operate, and highly cost-saving. Up to 90% savings potential in system costs and personnel effort. Faster access to medical data without waiting times. Higher patient retention. Better referring physician communication. New revenue sources through remote diagnosis and video consultations. Relief for IT through simple integration and automated processes. Crype is your key to modern, economical, and connected medicine. Now is the right time. Visit www.crype.eu and discover Crype with all the features of eHealth Connect. Also, watch our webinar on the general Crype features and discover how Crype not only impresses in radiology or cardiology, but makes all communication in your clinic, practice, or even in your private life more efficient. Contact us today and start your free trial. Thank you for your attention.